to all of you to IHW Council's special web series on women's health. I'm Anisha Nair-Dhawan and you're watching our exclusive show on infertility treatment and care during COVID-19. This is a public initiative by Bharat Serums and Vaccines Limited. The ongoing pandemic has raised serious concerns among everyone, and women certainly are facing the brunt of it. The impact of the virus is one that is there on their pregnancy, their childbirth, family planning, or even regular and common needs such as menstrual hygiene, nutrition, or mental health, amongst some of those issues that are bothering them. And there is one more thing that is causing immense anxiety and suffering to many, and that is the ability to conceive. Infertility over the years has emerged as one of the most common health issues that young couples have been facing in India. According to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of the Indian population. And the scenario is even worse in our cities, where 1 out of every 6 couples is impacted. Our show today is special as we are going to discuss every aspect related to infertility and how impacted women and couples can address this in the best possible way during the time of a pandemic. And to guide us ahead for this and answer all the questions that will be coming to your mind, we are very honored to have with us Dr. Suparna Banerjee with us. She is MD in Obstetrics and Gynecology and is the Clinical Director, Ankur Fertility Clinic and Research Center, New Alipur, Kolkata, West Bengal. Good evening, Dr. Banerjee, and welcome to the show.
Thank you.
Before we begin our conversation, I would request all our viewers watching, do send in your questions because ma'am is here for the next 40 minutes to answer all your questions, and we will try to incorporate as many questions as we can so that you get all the answers that you are searching for. Thank you so much for joining us, Dr. Banerjee. Now, in this time when there is a pandemic raging, and I believe in Kolkata, the rules are very, very strict. What do couples who are trying to conceive do about the anxiety? Because, just walking into a lab to get your monthly blood work is not that easy. When you walk in to get a sonography done, you're worried about catching an infection when you're trying. So there's so much anxiety. How can couples deal with this at the time of a pandemic?
Yes, so at the time of pandemic, because this pandemic is not a kind of a short-lasting few days, few months, we do not know exactly how many months or even years we have to deal with this pandemic. So our life will not stop, okay, because of the pandemic. So whatever you need to do, you need to do. But of course, need to take a precaution so that you do not want to infect yourself. But eventually everybody will be infected, as we know that number is increasing. So for an infertility checkup, I will advise whoever has already checked up by their doctors and advised whatever been advised, you can follow that advice. But who are new patients who have not seen any doctor, they can take an appointment because our clinics are not closed. And only on the day of complete lockdown, probably it's only the emergency services we are running. So in that case, our regular clinic will be closed. But otherwise, which is a normal day, not a lockdown day, then our clinics are open as usual time. So patients who are coming, taking all the risk, and they are coming from sometimes from district even. Even one patient, I always tell them that even one patient is there, I will open my clinic because they're taking so much trouble to come in first place. So definitely we are open. So we are advising regarding the, because it is an elective treatment, we can plan this treatment. So investigation, it is kind of a one-stop clinic. So whenever you come, you can do all the investigations there, then and there. Yeah.
Ma'am, I wanted to understand from you. Many doctors are now suggesting to their patients, say they have patients who have been consulting with them for diabetes or running chronic issues, that come for an online consultation instead of walking into the clinic. Now, I want to understand for an infertility patient, is this an option at all? And when they come to your clinic, do they need to go somewhere else for any follow-up?
I will say yes. The first time when they are coming for the consultation, that time basically we take the history and suggest few things. Okay, you do that, you do that. In that case, probably if somebody is doing because they are far, they cannot come. In that case, they can do it over the teleconsultation because I can take history and that will shorten our discussion, exposure, everything. But when it comes to your like antral follicle count, I need to check the ovaries, I need to do the ultrasound by myself, then of course I will expect the patient to come. So sometimes if somebody is doing teleconsultation and they are doing the test there, means locally, and some blood test and some X-ray, this sort of test, and when they send me the report and I see and I suggest the treatment, in that case, on that day, when I start scanning, I call them so that they come.
Ma'am, can you also tell us what precautions can patients take themselves and what precautions you take to ensure that it is a safe environment for patients to come in? And why I'm asking is because a lot of patients feel very anxious. They feel that the clock is ticking, time is against them, and they can't keep waiting for this to get over. Like you said, who knows when this is going to get over?
Exactly.
So what to do in this case? I mean, when you go out, should you go with should you put the fear aside and say, no, my doctor is taking all care, I'm taking all precautions, I won't get it?
Yes, we are taking care of this thing because once in a clinic, different people are coming from different places, and some are asymptomatic, so we don't know who is positive, who is negative. So whenever we are maintaining the social distancing, so we are keeping our appointment apart so that everybody should not come in the same time. Another thing is we are meticulously maintaining the disinfections. Disinfectant. We are cleaning the clinic in a few hours interval so that we can minimize it, especially the surfaces where people keep their hand, because it is basically going through the hand. And I will always ask my patient to cover your face with face mask. Some are coming with face mask, but for some reason when they start talking to me, they open their mask. They think I cannot hear, I cannot listen. So then I say that, look, I am wearing the mask. So if I can, I am talking to you, you can listen to me. So I can also listen to you. Yes. So some are who are pregnant, they are very cautious. They are taking shield as well, which is good. Because when you are using public transport especially and coming to a public space, then you have to take precautions. But otherwise, some people are still, they think they are taking masks very lightly, and they are coming, though I keep my patients' chair quite apart so that we do not infect each other. But some people still, they when they are talking to me, they think, I'll go closer to the doctor. So again, I have to tell them, okay, you sit there, I can still listen to you. And regarding the ultrasound, because it is a transvaginal ultrasound we are doing, it is not directly face-to-face exposure here. And time and also as well matter. So if the time of consultation is less than half an hour and scan takes probably hardly 2 to 3 minutes, so it's not a big exposure for anybody. And during time of scanning or after scanning also, we are cleaning the scan room and the probe meticulously.
Right. Ma'am, we've already started getting some queries, and I have a few questions from my side, but I'll take the queries first. So a Facebook user is asking, how is PCOS different from PCOD, and how can they affect fertility in women? And at what age would it be appropriate to get pregnant if you're suffering from either PCOD or PCOS?
So PCOS and PCOD is same. So nomenclature was polycystic ovarian disease. Now it is polycystic ovarian syndrome. So why it is syndrome? It's the new nomenclature. Syndrome means it is not a single thing. Disease is one, like diabetes is a disease. So disease is one thing. Syndrome is many things consist of syndrome. So why polycystic ovary is syndrome? Because it has got few features, some clinical features like weight gain, hirsutism, or excessive hair development, and your period becomes very irregular, erratic, or sometimes it's not coming at all, or sometimes you're bleeding like hell, and sometimes no bleeding. So these sort of scenarios are very common in polycystic ovary. And it has got polycystic ovary syndrome. So not only this, it has got a long-term life-changing event are there, like diabetes. So they are prone for developing diabetes and prone for developing hyperlipidemia and hypertension, even cancer as well. So it is all consist of a syndrome. Okay. Regarding the other question of getting pregnant, it is individual's decision. Nobody will tell. As a female, I can say that nobody will tell us when to get pregnant. It is our decision when to get pregnant, not even your doctor. Your doctor is not going to tell that you get pregnant. It is your life's priority. You think, okay, it is the right time for me to get pregnant. You get pregnant. If you have problem, you know you have polycystic ovary syndrome. You know you might need a medical help. In that case, you should not wait long trying, because once your period is not regular, you know your body's biological clock is not working normally, you need medical help. So in that case, you definitely go to your doctor, consult, so that your period becomes regular, and some little medication can help with that, and you can get pregnant. But time, it is depending on your life.
Okay, so if I put it differently, what is the best fertility window for women to get pregnant, irrespective of whether they have a condition or not, if they're normal or not? Yes. What is the best time in a woman's life to bear children?
Definitely in the 20s and beginning of 30s. So why we are saying that after 20 and 21, which is nowadays the Indian government has suggested that the ladies should get pregnant after 21, because your body gets mature and you are mature, your brain is mature to have a baby and to rear a baby. Of course, that is good, but 24 to 26, 8, before 30 is the best time. But after 30 as well, because it is, again, I am saying it is your life's priority, your ambition and your career that matters. So definitely after 30 also, some people is, some ladies egg reserve are good, and even at the age of 35, 38 also they can easily get pregnant. Yes. Some ladies egg reserve is poor, and then in that case they will have problems. So it is better before 35. All the studies, all the evidence suggests before 35 chance of pregnancy rate is higher, successful pregnancy and miscarriage rate is lower, and after 35 this rate increases, that is infertility risk of, yes.
Okay, so the best time is, according to Dr. Banerjee, is between 20 and 30, but it is your individual decision to decide when to have a child. But keep in mind, your fertility window is this decade, 20 to 30, where you have the best chance. You can get pregnant even after 30, but your best chance is between 20 and 30. Now, ma'am, we have another question, and this user in Facebook is asking, what causes infertility? Is it genetic? Maybe why this question is coming is, ma'am, because infertility is not really viewed as a disease in our country. It is more of a social taboo. Women who are not able to bear children are called names. People find all excuses and reasons to blame them. So, is there any genetic trace of infertility whatsoever?
Yes, there are genetic trends, but commonly first we divide infertility into 3 categories. One is female factor, one is male factor, and another one third is both factor. Okay, so among the female factor, one is ovulatory disorder, under which polycystic ovary syndrome is coming. Another is endometriosis, where also egg reserve is very low because of the disease process. So these are the egg reserve and ovarian factor, where some are having egg but they are not ovulating monthly, and some are having cyst, chocolate cyst, and poor response because of that. and
Okay.
some are in some cases ovaries are prematurely aging. That is the genetic factor.
Okay.
You see sometimes your female genetic line, you see they're getting menopause earlier. Like early means how early? If anybody is getting their menopause before 40, this is early menopause. All right.
Okay.
So some, if you see your family history, some are your mother and somebody's prematurely menopausing, or 40, 42, that is the age of menopause, then that woman will have definitely a genetic line where her chance of getting menopause earlier, that means her egg reserve will be lower in when she's 32. If somebody is getting 42 is the menopause, then when she is 32, so 10 years before that, her egg reserve is getting very low. So that's why I'm saying that 35, usually what we take menopausal age as 45 to 50 to 55 for Indian woman. So who is getting their menopause in 55, their egg reserve is very good even at 35, 38, 40. But who are getting menopause earlier than that, then they're 10 years before that, their egg reserve is getting poorer. So, and other factors is tubal factor. Sometimes tube is blocked. That is also female factor. And other than that, male factor, definitely sperm is also a major factor.
Ma'am, you mentioned that ovarian reserve, premature menopause could be a genetic reason for the for women infertility. Are there any genetic factors to men's infertility as well?
Definitely, there are genetic factors. Again, if you go to their family tree, then you will see some of the in some families I've seen all the brothers, they don't have any children. So definitely there is a family line, okay, where you see the male factor. This is a strong family history. And sometimes common history is Y chromosome, that is the genetic factor, is Y chromosome of male is the factor for this fertility or testosterone hormone and sperm production. Everything is related to the Y chromosome. When there is microdeletion of Y chromosome of different kinds, then that man become infertile, and that usually runs in their family. Other than that, there is another genetic disease which is common in whole world, that is called cystic fibrosis, and it is very common in Caucasian populations, but I have seen in our Asian ethnicity as well. There are factors who are azoospermic, who are azoospermic, that is no sperm present in their semen. In those cases, of course, we do this check to genetic test to check if they are carrier of cystic fibrosis, and that causes the block of their vas. There is no vas present, so they are producing semen, sperm, and it is not coming to their semen because there is no tube to carry that sperm from the testis to the outside world. So, and that is a genetic factor.
Okay, ma'am. So in your previous answer, you have told us that there are genetic factors that can impact fertility, both from the female side and the male side. For the females, what I understood was, if somebody in your family, mother, aunt, etc., your bloodline has premature menopause, you should be alert and try to consult early. So that is one way to tell. For men who may have a genetic reason behind the infertility, how can it be investigated? How can it be found out? And what are then the solutions?
Yes. So the thing is, if you got a family history, you know that you're in the family line, that somebody was trying and they don't have children. So definitely there is a kind of a alert, red alert. Okay, you should check. Everybody should check. So that's why infertility by definition, in who are infertile, if in a relationship unprotected intercourse is happening for 1 year, but still people are not getting pregnant, then the easiest test I would say is the male factor test, because semen analysis is the most easiest test. So that is everybody should go for that semen analysis part. But in our country, of course, female is female is blamed for
she goes for all the tests first.
Yes.
But there is a simple semen analysis that can diagnose the genetic cause of male.
Definitely.
Right? Great. Ma'am, we have more questions coming in. One Facebook user is asking, what is the cause of female infertility, which you have explained to us, the different causes. What is the best treatment for infertility?
Yes, there is nothing called best treatment. It is what is the cause we need to know. And according to the cause, we need to suggest treatment. So if somebody is like polycystic ovary, so we need to control their polycystic ovary. As you know that polycystic ovary is never going to go away. You cannot totally treat it, but you can control it. So you can control, and a patient can easily get pregnant after that with little medication. And if there is a kind of other cyst, tumor, your endometriosis, then sometimes operative treatment is needed, sometimes medical treatment is needed, depending on the situation, how big it is, how badly it is impacting your life. So these things all matters. And if there is tubal factor, when the tube is blocked, then there is a high chance that you will need IVF or test tube baby treatment.
Right. Ma'am, so this takes us to the next question, which is, I have been trying to have a baby, but have a block in my fallopian tube. As a result, the eggs cannot reach uterus of my ovary, and my endometrium is too thick or too thin at times. So my doctor is also confused. My AMH level is 0.9 ng by ml. I had an abortion 4 years back and was diagnosed with a thyroid problem. After that, I've never gotten pregnant again. Is there a medicine to cure this? So there are a lot of issues happening at the same time. One is a tubal block, then the endometriosis or endometrial conditions not being the best, plus a thyroid problem. So I'm sure you have.
Yes.
You would have seen a lot of these cases where multiple things are happening at the same time.
Yes.
What could you advise?
I don't know how old is she. But if the AMH is low, 0.9 is getting low, so she should try to get pregnant as early as possible. That will be my advice. If her tubes are blocked, then as I have already mentioned, if this tubal factor is there, tube is blocked, then her best chance is with IVF or test tube baby treatment. Regarding the endometrium thin or thick, it is very vague. I cannot say exactly what, because in IVF we can monitor her endometrium, and if it is not ready, we do not transfer her pregnancy, we freeze all the pregnancy, and whenever it is ready, then we transfer the pregnancy. It is in our hand in that case. So if there is a actual problem, if it is not getting thicker at all, then we suggest this and that and some operation. But if it is sometimes thick, sometimes thin, I don't think that is for treatment purpose, it does not matter. But sometimes it is not matching your cycle pattern. But here we are not talking about your normal cycle, because your tubes are blocked, so you need IVF.
Ma'am, she also added that 4 years ago she had an abortion and was diagnosed with a thyroid problem. I'm guessing she was diagnosed with this thyroid problem also 4 years back. And she's saying 4 years back I had abortion plus thyroid problem. After that, I've never gotten pregnant. So is this interrelated?
Thyroid problem, she can for that abortion, I don't know the cause, but if thyroid problem is there, she is taking thyroid medication, it is not going to cause infertility for that. And miscarriage is also not happening for this thyroid problem when it is controlled. But if there is a miscarriage, look, in a normal scenario, 25% of all the pregnancies going to miscarry. Its main reason, 90% cases is genetic abnormality, which can happen to any of the female, because that's the way nature works. But because she has a low AMH, so there is a probability that because of the low AMH, egg quality was poor, and that's why an abnormal pregnancy, and it aborted.
Right. She asked, is there a medicine to cure this?
No, your problem is not a single problem. You're saying your AMH is low. Definitely your doctor is going to give some medication for that to improve your egg, but your tube is blocked, so it's no way you are going to conceive with that tube. So IVF will be the only option. So there is no medicine to cure your tubal condition if it is blocked.
Right. Ma'am, one user is asking, is IVF the only method to treat infertility?
No, of course not. IVF is only method for tubal problem. If somebody's tube is blocked, like last lady, what she said is tube is blocked. So bilateral tube is, if your one tube is open, then also you have plenty other treatment option available. But if the both tubes are blocked, then there is no other options. Then no other option other than IVF or test tube baby. But if there one tube is open, at least one tube should be open, then you can have other treatment like intrauterine insemination or some simple treatment with medication that can solve your problem.
Right. Ma'am, one of the users, Facebook users or Facebook member is asking, what are some possible causes of male infertility?
Possible causes, nowadays we see that number of male infertility also increasing surprisingly, and number of sperm in semen is getting lower and lower, and the motility, the morphology or the normal count is getting lower and lower. There are number of reasons. Few are lifestyle factors, like number one is addiction, obesity, then disease like diabetes is one of the most common reason. And you see in COVID also we are seeing the diabetic patients are dying. So diabetes, if you have diabetes, if you don't know, just please check it. If the semen problem is there, I first check the diabetes. So because it is easily curable. If you see the patient is diabetic, you can control the diabetes, your semen count will be fine. So that is a very common thing. Otherwise, some patients have some low level of hormones like testosterone and other pituitary hormones. There's also treatable cause, and some are like pollution is causing some problem probably. And in that case, probably we are exposed to it. Everybody is exposed to it. But it is not affecting everybody in the same way. It depends on your body's natural immune power and the antioxidant level, how you cope with your pollution or exposure to anything. Some are coping well, some are good health, some are not that good health, they are not coping well, and their system is then weak.
So ma'am, this is actually leading into the next question. The next question from a Facebook user is, are lifestyle changes necessary to treat infertility?
Definitely. Lifestyle changes is very much necessary, because infertility is hello, can you see me?
Yes, ma'am.
Yes, infertility, look, it is a normal thing in the nature is fertility. So infertility in first place, why it is coming into action? Because of this problem. So definitely there is a role of nature. So if your body is very healthy, everything is functioning well, it is very less chance you will be infertile, because it's a natural thing. Natural physiology of your body, you will be fertile. So when it is not working in that way, for some reason, either hormonal reason, environmental reason, different reasons, so then you become infertile. So nobody is, born with infertility, I will say, in few rare genetic conditions which are different. Other than that, mostly we will be fertile. That is taken for granted. But infertility will be developing once your life advancing, your lifestyle, how healthy you are. Somebody is developing like thyroid problem, diabetes, blood pressure. These all are developing when you are with your life. It's not like you're born with this thing always. So definitely, if you control your, your physiology, your normal body mechanism very well, you are a healthy person. Like yoga can help as well. Good nutritious food, antioxidant containing fruits and vegetables, always we advise. So if you're then your inner power or your the cellular normal physiology will be very good, then your chance of infertility will be much less.
Right. Ma'am, another question that we have got is, does age play any role in male fertility as well?
Yes, in male fertility as well, but not as much as female, because as I was discussing, that after 35 chance of egg reserve is getting poorer and chance of miscarriage increases. But for male, we say before 45 is good time for male to get pregnant, your
start a family.
fertility or your start a family. But after 45 also, they will have semen, sperm in their semen. And you see, even in celebrities also, we have seen at the age of 80 years, they father child.
Children, yes.
So yes, so why it is different? Because for male, they are making sperm every day in their testes. So its sperm's age is equal to their age. Even if somebody is 60-year-old, his sperm is 2 months old, because it is taking the time from testis to the outside world. It is 2 months time, roughly.
Okay.
But for female, it is different, because we are born with eggs. We do not produce egg in our lifetime. So we are born with eggs. So if somebody is 30, so age is 30. Or somebody is 35, her age is 35, and we have got a limited or finite number, and we are going to exhaust in our reproductive life, and then menopause will come when we don't have egg. That's the menopause. But there is andropause is there is a entity, but it is not exactly, nobody can say one exactly andropause come. So any time of their life. But why 45 years? Chance of getting pregnant or good sperm is getting lower and lower because of the age. Again, with different comorbidities come in play with your age. Definitely that hinders the quality and I think and the other thing is with aging sperm, there is one problem related, that is psychological problem. So the babies will be born, but some psychological problem like schizophrenia, which is a very dangerous problem. So that psychiatric problem is related to aging sperm.
Oh, I came to know about that for the first time.
Yes.
Ma'am, another person is asking, is it safe to pursue infertility treatment in the current COVID situation? We discussed this, that we don't know when the COVID situation is going to improve, but is it safe to pursue these treatments?
You have to do it safely. Is it safe? It is a very difficult question. But I will frame it like that. Safely we can do it. Okay, whoever is needed, they have to do it. Like, somebody, as I have mentioned, that tube is blocked, then you don't have any other option other than doing a IVF treatment. Then of course you have to come, because COVID situation, when it is going to improve, you don't know. If somebody is at the age of 25 or 28, they can wait for another year if they are otherwise healthy, not a problem, only tubal factor. But somebody who is already 35 or 37 or 38, and they are thinking their fertility chances getting lower and lower. So I would not advise them to wait for 6 months or another 1 year after the vaccine will come, because their anyway chance of getting pregnancy will be even lower then.
Now,
so
another question.
Yes.
Another question is again similar to one that we've taken before, but the question should perhaps take it again is, when should one worry about being infertile?
By definition, as I have mentioned, it is 1 year of unprotected intercourse, and still you are not getting pregnant, then you are called infertile or subfertile. But for somebody who are already suffering from something, like they already know they have got endometriosis, they already know they have got polycystic ovary, a period was irregular, or somebody know that in the male factor, they know they have got erectile problem, or they know that in the family there is infertility, so he might be carrying something. So in those cases, you should not wait for 1 year to happen. But if you know you have problem, you can come earlier.
Okay, take consultation earlier. And we also spoke about the lifestyle issues that you spoke of. Now, the question that we got was, are lifestyle changes necessary to treat infertility? In your answer, you said that yoga is a good idea and nutritious diet.
Yes.
So if you were to list the top 3 lifestyle changes to improve your fertility, what would they be?
First thing, keep your body mass index or BMI in a normal range. So for Indian women, we are average height, so it is 5'2", maximum 5'4", 5. So it is for you to maintain your BMI around 23 to 25. So you should not get obese. Two thin persons or ladies are there, but I think in our practice we all see most are overweight or obese. So definitely that is not going to help for your fertility. And for that, I always advise low carbohydrate. Lessen your carbohydrate in your diet, because our Indian diet containing 70% of carbohydrate, and whatever we want to, it's eye-catching. We want to eat that is carbohydrate. So carbohydrate is very tempting. So you have to carb your carbohydrate, and you can have your fruits, nuts, vegetables, and protein. But you have to cut down your carbohydrate, and regular exercise can cause, why it is good, even yoga is good, because it increases your mental strength. Only yoga, like pranayam and these things, this increases meditation, this increases your inner strength. Mental health is very important in fertility as well, because when you are worried, then your in our brain there are different chemicals are working. Okay, and imagine fertility, pregnancy is a very good thing. It's a mood elevator kind of a thing. Okay, we feel joy, then we love, and then we have sex, then we get pregnant. So it is a natural thing to have your mood high when you're pregnant. So if you are on the other hand, if you're a depressed person, physically, mentally, something, then your that mental small chemical things which will be working to control your hormone, to control your body function, will not be
conducive.
Not going to help you to get pregnant. So it's easier said than done, but keep your stress level low. And how you can keep your stress level low? Doing some like yoga, exercise, something, and something you feel good.
Okay, so I'll just recap the three main things you have said. Is BMI has to be ideal, so you have to have a good mix of a nutritious diet and exercise. Plus, you have to keep your stress levels low so that the chemicals in your brains are such that they're conducive for you to get pregnant. And of course, if you have any bad habits and addictions, you should give them up as well. And ensure optimum health for a fertile, fertile ground for nurturing a family and raising a family. Dr. Banerjee, thank you so much for joining us on this chat and answering so many questions that we have received from people who have questions about infertility. Maybe they are going through treatments and want some more answers. And if you have, to all those who are watching, if you still have questions, do send them in. This is a public initiative by Bharat Serums and Vaccines, where we are talking about infertility and the treatment. If you have questions, keep sending them in. We will try to get them answered. Thank you so much, Dr. Banerjee, for joining us on this chat. We will be back with another special show on women's health shortly. Do follow us on Facebook and get all the updates on our upcoming programs, and keep sending us your questions. So we'll have a bank of them ready to ask from our experts when they join us next. Till then, stay at home, eat healthy, sleep well, and give your mind and soul a daily dose of positive thinking. And don't forget to maintain personal hygiene and social distancing to protect yourself and your loved ones from the coronavirus. Goodbye, and see you soon.
Bye.
Bye-bye.
Bye.